consultant, laparoscopic and general surgeon at Manipal Hospital Whitefield. Today I will be talking about the most common problem in our general public is the gallstones disease. Gallstones are also called the accumulation of stones in the gallbladder. So gallbladder is situated just below the liver. Basically, the gallstones are formed when the function of the gallbladder is inadequate and when there is a impairment of the bile contents like cholesterol, bile salts and bile pigments with the water. So basically, gallstones will be formed in any person where the gallbladder is not active. So the inactivity can be because of some hormones like progesterone, which is present in high quantity during pregnancy. So many people who has completed pregnancy are high risk of developing gallstones. It also seen in persons like obesity, and if there is some disorder where there is a destruction of red blood cells leading to excess accumulation of bile salts and bile pigments. 1 in 3 females and 1 in 6 males has a risk of developing gallbladder stones. Basically, many people are asymptomatic, meaning they don't have any symptoms related to the gallstones. Whenever symptoms develop, it can be a minor symptoms, something like bloating sensation in the abdomen, wherein tummy feels full all the time, even without eating. It can be indigestion, especially to fatty foods. The major symptoms are the pain in the abdomen, especially in the right upper quadrant of the abdomen. So this happens whenever the gallstones, there is a blockage at the exit of the gallbladder, leading to inflammation in the gallbladder, so causing pain in the abdomen. The patients also can present with jaundice. Jaundice develops because whenever the gallstone slips from the gallbladder into the common bile duct, which is a channel from the liver into the intestine, which carries bile from the liver into the intestine. Whenever there is a blockage in this channel, the jaundice is developed. This is like a complication of gallbladder stone. Rarely, whenever there is a long-term presence of gallbladder stones, can lead to cancer as well. So the diagnosis of gallbladder stones is made through whenever the patient presents with symptoms, these symptoms, minor or major symptoms, we'll examine him clinically and order some tests. The tests include the ultrasound of the abdomen as well as liver function test, which is a blood test. The ultrasound abdomen is the gold standard in diagnosis of gallbladder stones. And liver function test will indicate whether there is any complication secondary to gallbladder stones. Basically, since many of the patients are asymptomatic, they may not require any treatment for gallbladder stones. However, when they present with symptoms, so basically we decide whether the symptoms are significant or non-significant. So when there are significant symptoms are there, so we initially treat with medicines to reduce the pain and plan for further definitive treatment. The definitive treatment includes removal of gallbladder, which is done through surgery. The surgery of the gallbladder in there are two types. One is keyhole surgery, which is commonly done nowadays. The keyhole surgery is also called laparoscopy. It is done through 4 holes. The holes are very small, so the biggest hole is 1 centimeter in size. So the surgery is quite simple when it is presented at the right time. However, the surgery also can be complicated if the person presents with the jaundice and severe inflammation of the gallbladder. Other method of treatment is open surgery. So nowadays not commonly practiced. However, when the laparoscopy fails, we do open surgery. Since the gallbladder doesn't have any digestive function, it only acts like a storage organ, right? Removal of gallbladder doesn't have any long-term side effects. However, very few side effects are noted where there is increased frequency of stools, which can be easily controlled with the medicines. So, no long-term effects of gallbladder surgery removal noted at present. So, my message to the public is, whoever has symptoms like minor symptoms like bloating sensation or gastritis-like symptoms can also have a gallbladder stones. Please visit a treating physician or surgeon for further evaluation of symptoms and get the treatment at the earliest. Thank you.